Hi parents, this is Dr. Doug. I'm a father of 4 and a licensed psychologist, and today I'm sitting with Dr. Kelly. She's a mother of 4 and a pediatrician in Durango. She also happens to be my wife, and I'm going to ask her some questions here that might provide parents some insights to help keep themselves and their kids healthy. So, Kelly, what are some symptoms that children might show if they're experiencing COVID-19?
Well, it's interesting. Right now, kids could have no symptoms. They could be totally normal and be asymptomatic spreaders. They could have mild symptoms, just like the common cold that you're used to with your kid with runny nose and congestion and cough. They could also have flu-like symptoms, headache, body aches, fever, diarrhea, sore throat, a whole constellation of symptoms.
And so when should parents really get concerned and seek care when they're seeing some of these symptoms?
So the red flags are any fever for 3 days or longer, any work of breathing, shortness of breath, chest pain, respiratory distress, or really lethargic. Your child cannot get up to get themselves to the bathroom. Those would be reasons to reach out to your primary care doc and ask if now is the time to be seen or what to do for more emergent care.
And so what should parents do if they think their child is sick?
So do the normal stuff you would do. If your child has underlying chronic illnesses, to make sure they're taking their asthma medications, allergy medications, diabetes medications. Make sure all their usual medications are taken daily during this. And then do the medicines you would normally use. If that's ibuprofen, acetaminophen, allergy medicines, cold medicines that are age appropriate. Keep them hydrated, water, Gatorade for fluid replacement. Good sleep, good rest. Do all the normal stuff that you would be doing. And reach out to your primary care doc. The primary care offices, most of them are open. They're taking phone calls. They may not be able to see patients, but they're available. Our office is doing telemedicine visits, so we can see patients over a screen, sort of like FaceTime, so we can get a sense of how sick your child is and give you the guidance and education you need.
So what should parents do, or what can parents do to help prevent their kids from getting sick?
Great question. Education is key. We don't have a vaccine. We don't have regular medicines yet to treat that, but that's in the works. So prevention is the whole social distancing and trying not to be exposed. It is good hand washing, 20 seconds, warm water and soap, or carrying around hand sanitizer that has 60% alcohol. And really the key is it's spread through person to person and contact, so touch. Things you're touching and then putting them in your face. So do not touch your face. Wash your hands frequently. Use hand sanitizers. Clean down surfaces, Clorox, Lysol, bleach solution, and try to just avoid being around people who are at risk.
Now, if parents have a child who is sick, how long should that child be in isolation or quarantined?
Currently, because we don't have a lot of testing to know for sure you have it, or then to be able to test that you don't have it, the current recommendations are at least 72 hours, 3 days, without having a fever and not medicating the fever, at least 7 days from the start of symptoms, and then making sure all the current symptoms have resolved. You feel completely back to normal, no more cough, runny nose, congestion, or fatigue.
Okay, so this is Dr. Kelly from Pediatric Partners of the Southwest, and I'm Dr. Doug. Be your child's hero.